Thank you for staying with us. Now, this is a biggie. As I always say, so Nigerians spend between $1.2 billion and $1.6 billion on medical tourism every year.
Pause.
Oh.
Did you say dollars or is it a wrong sign? Or?
Dollars. Not naira.
Maybe Zimbabwean dollars. I mean, could it be?
One and the same thing.
Dollars, as in American dollars.
What?
And that is a huge drain on dollars that we don't have. So how can we begin to reverse this? Okay, COVID came along and showed the soft underbelly of our health sector. And like we have said many times on this program, we had hoped that COVID was a leveler. Even the rich and famous and mighty, no matter how much dollars they had, could not leave the country because the whole world was in lockdown. Even when you do have the money and you're in a critical condition, before you, the air ambulance is organized, before you are taken to the airport and you are flown to where you're going another 6 hours, you may be the late Chief Alaji so-and-so.
And even when you get there, if you successfully get there, there is a high chance, we'll know from our guests,
that you are going to be attended to by a Nigerian doctor.
2,000 of which leave the country yearly.
I mean,
let's just go on.
My mind is totally befuddled right now.
Calm down.
Totally.
Calm down.
Okay. Okay.
Yes.
All right.
Okay.
Thank you. Thank you.
Yes.
Thank you. Thank you. Okay. I am now calm. At this point, I shall introduce our guests. Dr. Adedoyin Shitta-Bey, Chief Executive Officer, Duchess International Hospital. Thank you for coming.
Thank you for having me.
As well as Dr. Adedoyin Dosunmu-Ogunbi, Medical Director, Duchess International Hospital.
Thank you very much for having us.
Dr. Dosunmu-Ogunbi, please tell me that all these things we have just said are lies.
Well, it looks like
every time someone starts the conversation with "well," you're right.
Precisely. I was going to say you're already doing our jobs for us. Of course, Dr. Shitta-Bey, as the CEO of Duchess Hospital, and myself as medical director, you are really you've laid it out so very well. 1.2 to 1.6 billion US dollars every year that Nigerians spend abroad. And they may even see a Nigerian doctor there, just like you said. So it makes more sense for us to build the capacity here in our country, and for our people to stay here, and people to even come here. Why can't other people come to Nigeria to get the health care?
But that was the experience before. We
yes.
understand that was the experience before.
In the days of UCH, when Luth was first built, the whole of West Africa, it was the hospitals for the whole of West Africa.
That's right. Like I tell people, my mother flew from Canada to UCH to deliver me.
Jesus Christ.
And that was quite typical, I hear.
Absolutely.
Excuse me?
Can you say that again? I just want to be proud a little.
Yes. My mother flew from Canada to Ibadan, to UCH, to deliver me.
And you are still here?
And I'm still here. I'm alive.
Alive and well.
Alive and well.
Now even a medical practitioner.
UCH born?
Yes, absolutely.
I mean, she gave up the chance to have him in Canada. She wanted him to be born in UCH because UCH had the capacity to do the job. Such was her confidence in UCH that she medically toured. We're talking about medical tourism. Medically toured to UCH to have her baby. Come on, Nigeria, wake up. Wake up, Nigeria.
Calm down. I said
Come on.
Calm
Okay. As the kids say, Pharaoh. Okay.
Dr. Shitta-Bey.
Yes.
1.2 to 1.6 billion dollars yearly. How bad is that?
That is extremely bad. It's a hemorrhage, isn't it? If we break that down, that translates to about 60,000 Nigerians hopping on the plane each year to spend approximately $20,000 a trip.
Each.
Absolutely. Absolutely.
But
And,
it really...
money which we can use.
oh, yes, money which we can
Really?
preserve and use right here.
life is sweet. And everyone wants to live at whatever cost. Since the 80s, I've been hearing about brain drain. And when I hear brain drain, it's always largely in the medical sector. Do you blame the people who go on medical tourism?
That's an interesting question, and it's a question of responsibility. And the way that I would normally respond to that line of questioning is to say it's an opportunity for us as medical practitioners, policymakers and the government to look inwards and think rather about why people are choosing to leave the country. And that brings us to what I have come to understand as a crisis of trust. The real reason that people are choosing to leave the shores of this country, the real reason we have this hemorrhage of about 600 billion naira, to put it in context, is because people do not trust the system. But why is it that people do not trust the system? That ultimately is what our responsibility is. You want a system that, of course, is capable of delivering high-quality care, robust governance, both clinically and administratively, but a system that is operating under the right policy and regulatory environment, a system that is able to draw upon robust public infrastructure. Okay, those are all of the things that have contributed to this mass exodus that you see, not just of individuals who are consumers of healthcare, but those who also would like to be in the position to provide healthcare in the sort of environment that would simply validate their education, give them the chance to feel that they can practice autonomously in an environment that is robust enough to give them the desired reward for all of the effort that they are putting into it. And it's not just monetary. You want to know that you're actually making a difference and that the system is there to enable you make a difference as well. Okay. So I would rather focus on that responsibility that we have, and that's part of what we're trying to address at the Duchess International Hospital.
Dr. Dosunmu-Ogunbi, it is not, this trust that he's talking about, it's not because Nigeria does not produce good doctors. Because, I mean, if they are able to leave this country in their thousands and get jobs in America, in the UK, in Canada, in Saudi Arabia, just name it, it's not because of their expertise. Nigeria produces good quality doctors. So why is it that they do not stay?
So it goes exactly to what Dr. Shitta-Bey has been saying, that yes, we have the required materials, we have the required tools. In this case, we're talking about human capital. We're talking about doctors and nurses and other allied healthcare professionals, by the way. They are perfectly capable. They have the potential, but the fundamental structures are not sound. We don't have the proper governance, sometimes publicly as well as even within hospitals. So this is a responsibility of all of us, our leadership at large, leadership and leadership in the medical community. We all have a responsibility to build the required structure so that people can be optimized to perform at their highest capability. If we have the correct structures in place and it's properly funded, then people will be able to bring out their best potential, which unfortunately is what happens now when so many of our professionals leave and they go to the US, to the UK, to Europe, and there they flourish because the structures are in place that enable them to flourish. We need to build those structures here, and it needs to be funded.
And in your experience, I'm sorry, in your experience, What do people mainly travel for?
You're referring to patients now,
Patients,
right?
yes, yes.
Well, trust is a huge component, frankly. So they trust the governance that are in place in those countries. Even things like confidentiality can be a part of it. But well, that's
Confidentiality.
that can be that is something that we need to make sure as medical leaders, we in our organization, Duchess Hospital and the Reddington Group, we stress that so that people can have confidence that that their information is properly handled. So we take that very, very seriously. So that's part of the trust that we are looking to build and instill so that people can understand that they can trust us with their lives and with their information. So that's all a part of it.
Okay. The question I believe Alero is asking is, what
kinds of
ailments or
yes.
procedures
Yes.
do people travel out for? You recently, in your hospital recently, treated the vice president. Some would probably say maybe it was just a cut in the hand, so you just give him a plaster or something that can be handled in Nigeria.
No, the papers said he had knee surgery.
No, actually, it was the thigh. So he had a fracture of the thigh bone. So which the major bone in his leg. So that is a major bone. So to answer your question better. Orthopedic surgery, such as the vice president underwent, and we, of course, have that capability as been.
Well, that's good PR for you that the vice president was in your hospital.
Absolutely. There's
We
cardiac
were always
surgery.
going to settle on that question in this interview. It was obviously going to get there, but please carry on. Yes.
Absolutely. So that occurred. So orthopedic surgery, and we mentioned you mentioned knee replacements. That's not what the vice president had, but we have.
That's also
we
available.
have yes, and we have performed that.
My sincere apologies, yes. Dr. Dosunmu-Ogunbi. The question she's asking is, are these the kinds of things that people go abroad to take on?
Yes.
Are there situations where, okay, we can't handle this in Nigeria, you have to fly it abroad?
Well, I'll be very frank. It's not that we can handle everything, and I was in the U.S. for a number of years, and especially medium-sized cities may not be able to handle everything, and you still have to refer even there, albeit still within the same country. But however, there are many things that we are able to do, which Nigerians are still traveling abroad for and don't need to. Knee replacement is an example, and there are a number of even cardiac operations which are now being done here in Nigeria. Places like Lagos and Abuja especially, and even I believe in, out east too. There are some places where we are able to perform, open heart surgery, and so we are building capacity here. It is a work in progress, but it is occurring.
Now, talking about capacity,
yes.
Well, you're going to go there. But we have gone there ahead of you.
Yes.
So let's.
No, I wasn't going to go there.
Oh, okay.
We're always going to be pushed there.
No. Okay. I mean, it's a natural question. I wouldn't be a journalist if I didn't ask you that question, would I?
Yes, absolutely.
Okay, so
I totally sympathize.
Thank you very much for your sympathy. Now, the reason I asked that question is, we can't talk about medical tourism without affordability.
Absolutely.
God, 1.2 to 1.6 billion dollars. You don't pick it on the streets.
No.
So you have to have the means. You broke it down the other time, $20,000.
Absolutely.
I'm trying to do a math in my head now. I can't because I failed maths in secondary school. But
you're in good company.
Oh, thank you. So
no, you couldn't have, and you did medicine.
No, not me. But, but you're still in good company.
Okay. So $20,000 to go out of the country for something that could be done in country would be cheaper, far less risk, and all of those things. So I'm just wondering, what would you be saying to those who can afford to travel but have probably not even scarred the nation. Well, I know you're here because of your company, but everyone may not. I mean, you will be overwhelmed if everyone who needed your services came to you. But some haven't even scarred the nation enough to check whether or not these things are possible in country.
Absolutely. Okay, so I would respond to that question by picking up on the response to your last question. We know, of course, that about 60% of the medical tourism is in search of chronic disease, so diabetes care, cancer, dialysis, major things like that. But people are also in search of more minor things, lumps and bumps, okay, things that ought even to be taken care of in primary care and perhaps even in secondary care. So that's what makes up that.
My apologies.
Yes.
So for primary care that the local government could take care of, people traveling
They're
abroad?
getting on a plane?
Well, I mean, people are leaving to do all sorts of things abroad, but I think the real issue is in responding to the heart of your question, coming back again to the question of trust. They haven't even scoured the nation, yes, because there is a public perception that there just isn't the service there to be had, and that is the truth. So people are leaving to have things done abroad that can be taken care of in this country. And at this point, I must put my hand up and say, well, we have lots of really good hospitals up and down the country. Plenty of very good facilities, plenty of very good doctors, not just the Duchess Hospital. In any case, you know, this country will need at least 20, if not 50 Duchess hospitals. So it really has to be about collaboration. One hospital cannot take care of it. So it really is about raising the game, making sure that the system is properly funded. For example, the sort of funding help that we received from the Central Bank and the Bank of Industry has enabled us not just to be in a position to offer these services, but also, to speak to your last point, to offer them at an affordable price. Okay, so at the Duchess Hospital, we speak in terms of access to affordable world-class healthcare. So it's a huge, sprawling, imposing-looking building. But what we're actually saying is that this is a facility that is open to the community because of the funding help that we have received, which really we would like to see rolled out around the country. We're able to pass the benefits onto the people and
as many as possible.
Offer that access to world-class affordable healthcare. So I make bold to say on this program, for example, that for precisely that reason, to register the Duchess International Hospital is no more than 5,000 naira. To see a doctor is no more than 5,000 naira.
What about consultation?
Consultation, yeah, absolutely. I just said it, no more than 5,000 naira. Okay, to see a family physician. We know, of course, I'm a family physician myself.
This is not propaganda, is it?
No, it certainly isn't propaganda. It is absolutely substantiated by fact. We know, of course, that about 80% of problems in a well-structured healthcare system ought to be taken care of in primary care. So you can see the benefits of having a system like this that's well-funded, not just at the Duchess. If we're able to extrapolate this and roll it out across the country, you begin to have the start of a well-structured healthcare system, not just in Lagos or in Ikeja, which is where we are, but in Abuja, other places around the country. We can begin to raise the profile of healthcare in this country, and perhaps at that point, people become encouraged and they know that these services are available all over the country, and they might then be more inclined to remain in this country. And we stop hemorrhaging that 600 billion naira each year.
Now, Doctor, I think that the Vice President having his procedure done in Nigeria was a masterstroke. How much do you think this will instill more confidence in Nigerians that they don't need to run across to Germany when they have a headache, that actually there are facilities in Nigeria, if they bother to search, that can take good care of them?
I really want to commend the Vice President and express my gratitude, I would say, on behalf of the Nigerian medical community to him for that. And I do do believe that that shows leadership. And in fact, we have already seen people already contacting us, more people walking through our doors precisely because of the Vice President's action that he took.
That's to be expected. That's to be expected.
Yes. So, I have to say, you don't just lead by speaking, but by example. And he demonstrated it. He demonstrated his confidence in us, and indeed, it has resulted in by their fruits we shall know them, and this is the fruits of that.
So, should you get overwhelmed? I asked Dr. Shitta-Bey the other time. Well, I was going to respond to something that he said the other time. You are the CEO. He is the director, so he knows where this true pinch is right there in the hospital. So, should there be an overwhelming situation? Because just as you said, people will begin to search the country and they will find, as you said, 60, 70, okay, let me not blow my trumpet. Maybe just about 1 or 2, 3, 4, 5, or maybe 10 such Duchess internationals all over the nation. Should there be an overwhelming demand for those services? The challenge that people have had over time is sustaining the quality of service delivery. You just talked about, you just let us know that you are a Nigerian-born foreigner. Okay, so, I don't know if anyone would want to travel from wherever in the world to give birth in Nigeria again. So it's a challenge of service delivery, sustaining the quality. Should there be a surge in demand?
Well, I can't sort of deny that that is a challenge. You're correct. You have, and it's, of course, it is my job. My CEO will be looking to me and does look to me to provide and to maintain that quality. It is a challenge, and what we need in general as a system to meet this challenge is funding, and of course capacity and capacity building, and of course a big part of my job is to make sure that we have the capable people in place and in the correct numbers to meet this challenge and this surge. We certainly have the potential for that capacity within the country, and sometimes you have to source some of this capability from outside the country, usually from Nigerians. We're still talking about Nigerians here, but we know that so many of them have left the country. Well, a place like Duchess, and as you said, there are other duchesses around this country, very frankly.
As he said, I did.
Yes, well, yes. And so places like Duchess are able to attract these Nigerians who have top-notch qualifications, and we are doing so. We have a program to provide top specialists, again, mostly Nigerians, who may actually be abroad, and they actually can provide consultations, sometimes virtual, but they also come physically to Duchess. They even come and operate in Duchess from wherever they're based, whether UK or US. So those are the techniques we are using to provide the capacity.
So you try not to hemorrhage personnel.
Precisely. In fact, we are attracting them. The reverse medical tourism is starting with those personnel.
Would you say that this surge has actually started with the VP coming to your place? Because the VP not going abroad is going to strike a lot of people. I mean, I'm sure many of them hadn't even heard of you until he came along. So do you think that this is going to make more people actually search, say, oh, if the vice president, no less, can subject himself to, getting this kind of medical procedure in Nigeria.
Nigerian doctors.
it means that there are many more hospitals like this around. So maybe I should shop around Nigeria before I commit to flying off to India or wherever.
Absolutely, and what I will say is that the Vice President coming to the Duchess International Hospital, and there is only one Duchess International Hospital, by the way. Many hospitals doing wonderful things up and down the country, but there's only one Duchess.
For now.
It is for now,
Such conceit.
Yes, absolutely. So it is a remarkable vote of confidence in the Duchess, in our facilities, our services, the capacity that we have to deliver this service. But it is also a very, very important statement about what this country can offer, okay, and what should be happening in terms of not just patronizing, but investment that needs to go into the healthcare industry in this country. I'm sure, of course, that a lot of thought went into the Vice President's decision to do that. And I think the Duchess Hospital had the opportunity on behalf of the entire healthcare industry to say that, well, we can do this. And we hope that we were able to serve the Vice President and the people of the Federal Republic of Nigeria correctly
Just one last thing before we go. So we have all of these challenges. We have all of these limitations. Yet the number 2 man in the country of 200 million people chose to literally place himself in the hands of the medical industry in the country. What does that say? That we have these challenges, but I'm still here.
Absolutely. It shows very strong leadership. It says, in one stroke, I believe in you, I believe in the Duchess, and I believe in this country. Okay, and I would say long may that continue.
Amen to that. And that is where we shall leave it for today, in the hope that the next we will hear is that the President himself, instead of jetting out to London every time he has a headache, will actually find one such hospital in Nigeria where he will present himself to be treated. Thank you very much, Dr. Shitta-Bey, who is Chief Executive Officer, as well as Dr. Adedoyin Dosunmu-Ogunbi, who is Medical Director, both of the Duchess International Hospital.
Thank you for having us.
Thank you very much.
The hospital which has now become very famous for having treated the Vice President of Nigeria.
Yeah.
Thank you very much for coming, gentlemen.
Thank you very much.
And good luck to you.
Thank you. Thank you too, both. Thank you.
Sunrise will see you in just a moment. Do stay with us.